In my 25 years of working as a physiotherapist, I have found one move can often be a real reliever when it comes to sciatic pain down the leg. Now, before I introduce you to that move, two things need to be covered. Number one is that basically this isn't going to help everybody because sciatica is really complex and it's something which can have multiple different causes. And this is for a specific type of cause that this helps. But it is quite common that this does help. So if this helps you, fantastic, but it won't help everyone, full disclaimer. The second thing is focus on the leg symptoms. We're talking about improving the pain in the leg, reducing the pain in the leg. And that's the key thing with sciatic symptoms, is that we want pain in the leg to disappear and to move higher up the leg until it's not in the leg at all. So those two things are really important. So let's get on with looking at the move. And at the end, I'm going to show you how many times you should do it during the day to improve your situation. Okay, so let's talk about this move. What we need to do, very simply, is bend forwards at the waist. Carefully, does bending forwards at the waist increase our leg symptoms? Does it create more pain going down the leg when we bend at the waist? If it does, then what we need to do is actually exercise in the opposite direction. So we put our hands on our hips and we lean backwards at the waist. And we do that 10 times. Very, very simple. We avoid the motion that causes the pain to increase in our leg. We do movements, and this is the move, backwards away. Now, what that should result in is actually a reduction in those leg symptoms as we go through those repetitions of 10 of taking our hips forward and leaning backwards at the waist. It can be slightly sore in the lower back. That's all right, providing it doesn't get too sore. But the key thing is, do the leg symptoms reduce by doing that? Now, you might need to do that a few times, perhaps, over the course of a day to increase the benefits of it, to reduce the sensations of pain in your leg. But if it's going to work for you, there will be a clear distinction of reduction in pain, and it's going to gradually reduce. Now, of course, the opposite can be true. If you have pain when you lean backwards down your leg, that's the key thing, down your leg when you lean backwards at the waist, or even when you're standing upright, but it eases when you bend forwards, then the opposite is true. What you should do is then exercise forwards. Now, we should be careful with bending forwards a little bit at the waist. So what we can do is we can exercise sat on a chair. If we sit on a chair and bend forwards, reaching down to the floor, we've taken the pressure off the back, but we are opening up the back, and this should result in less symptoms down your leg. An alternative is to actually lean against a wall and use the wall to support your weight as you slightly bend forwards at the waist. Again, that bending motion should reduce your leg symptoms. So how many times should you do this during the day? Well, first of all, we need to make sure that this works for you. So if you are doing these exercises one direction or the other direction and it reduces your leg symptoms, then you should absolutely do this often. It might be you do this every half an hour, every hour, but actually the more you do it, the more likely you are to have some beneficial changes. So how many times to do it? I would say do it frequently through the day. You might do 5, 6, 7 times a day of 10 repetitions. But in that specific direction only. So let me be clear. If you have pain going forwards, you should exercise backwards only. If you have pain backwards, you should exercise forwards only. And that is a secret sauce, one specific move that actually can make a big difference in terms of your leg symptoms. I certainly hope it does for you.